name is Katrina and I'm going to be doing a dry dressing change for you today. First, I would check my physician's orders, and then I would gather my supplies. Okay, so I'm going to go into my patient's room. Hi, Mr. Smith. My name is Katrina. I'm a student nurse, and I'm going to be changing your dressing today, your dry dressing. And could you please state your name and date of birth for me, please? Okay, and I'm going to check that against my orders, and that all lines up, so we'll go ahead and proceed. First thing I'm going to do is I'm going to get my hand hygiene out the way, make sure my hands are nice and clean. Next, I'm going to put on some clean gloves, and we will remove this dressing. So I'm going to peel the tape carefully, making sure not to damage the skin or tear the skin. I'm going to do this all the way around the dressing. And when I get all the tape peeled, I'm going to lift the dressing straight off. And I'm going to assess the drainage on the dressing. I'm going to look for any kind of purulent or bloody or serous drainage, and I'm also going to notice if there's any malodorous about the dressing. Now that I've done that, I'm going to go ahead and toss that in the trash. And I'm going to, at this point, I would remove my gloves, I would perform hand hygiene again, and I would don a new pair of clean gloves. Okay, so now I'm going to assess the incision itself, and I'm going to look at for any swelling. I'm going to look for any drainage. I'm going to count the staples or sutures, whatever the surgeon decided to use to close this wound. I'm going to assess for any kind of odors, anything that would give us an inclination that there might be an infection going on. I'm also going to ask the patient for if he has any pain or a level of pain on a scale of 0 to 10. Now that I've got that out of the way, and I'll use that for documenting purposes at the end. Now I've got all my supplies here, and I'm going to open my gauze. And I have a second gauze. I have an ABD pad here I'll open in just a second. I've got all my tape ready for my new pad, and I'm going to take my saline and just quickly look at the expiration date, and it is not expired. I'm going to put the label towards my hand, and I'm going to open the cap and just slip a small amount into the garbage can, and that'll help keep the lip of the bottle clean. So now I'm going to go ahead and pour this into my container with gauze. Get that nice and saturated, and I'm going to start cleaning the wound. First, I'm going to grab a saturated piece of gauze, and I'm going to do a wonton technique where it keeps my hands away from the wound but allows me to clean. So what I'm going to do is I'm going to go from the distant part of the wound from me, and I'm going to go from clean to dirty. So I'm going to go from the inside of the wound out. And I'm going to do this all the way down the wound. Every time I swipe, I'm going to get a new piece of gauze. So I'm going to throw that away. I'm going to get a new piece of wet gauze, and I'm going to go from the inside of the wound out. And I'm going to throw that away. I'm going to get a new piece of gauze out of my saline, and I'm going to go from the inside out. And I'm going to do that all the way down the wound, getting a new piece of gauze each time. Throw that away, new piece of gauze, and out. Now I'm going to start down the other side of the wound, and I'm going to grab another fresh piece of gauze. And now on the side that's closest to me, I'm going to go again from clean to dirty. So I'm going to go from the inside of the incision out, tossing that piece of gauze. I'm going to get a new piece of gauze, go from the inside out, throwing that away, getting a new piece, going inside out, throwing that away, and going from the inside out, throwing that away. Now I will grab a final piece of wet gauze, and I will do the same wonton. And this time I'm going to go down the center of the incision, one swipe, and then I would throw that away. Now I'm going to do the same procedure, but with the dry gauze. I'm going to get my wonton, and I'm going to first go from the side of the incision that's furthest from me, And I'm going to go from the inside out, throw that away, grab a fresh dry gauze, and go from the inside padding out, throw that away. I'm going to grab another fresh gauze, going from the inside out, padding to dry, and I'm going to do that all the way down the incision. Then I'm going to go to the side of the incision that is closest to me, and I'm going to grab a fresh piece of gauze each time, and I'm going to go from clean to dirty, going from the inside of the incision, padding outward. I'm going to throw that away, grab a fresh piece of gauze, going from the inside out, throw that away, grab a fresh piece of gauze, going from the inside out, and I'm going to do that all the way down the incision. Finally, I'm going to grab another piece of dry gauze, and I'm just going to dab down the center of the incision. Now, the dressing should be dry, or the incision rather should be dry. I've got all my tape ready. I'm going to fold a piece of dry gauze, and I'm going to place it over the incision. I'm going to open my ABB pad and remove it. I'm going to place this over the clean incision, and I'm going to tape it into place. Okay. And one more. And with my last piece of tape here, I'm going to place it on the wound. And this is going to be for labeling purposes. I'm going to, with my pen, I'm going to write the time and the date and my initials that this wound was dressed, so that the next nurse coming in knows when this wound was cleaned and freshly dressed. And I'm going to remove my gloves. I'm going to perform hand hygiene, clean up my mess, and then I'm going to document what I did. And I'm going to document that I cleaned and changed the dry dressing. I'm going to document anything that I found about the wound or the dressing change, any kind of drainage, any swelling, any pain reported by the patient, also how he tolerated it, and he seemed to tolerate it well. And that's going to conclude the dressing part of this recording. Next, I just want to talk briefly about the different kinds of dressings. So first we have gauze, which we just used, and that would be wet or dry, and we can also use that for packing. We also have transparent, and transparent is good for IV sites and skin tears, and this allows the nurse or the physician to quickly assess a wound and see it without having to remove the dressing. Next we have hydrogels, which are good for moisture with a dry wound, and these help to add moisture. Next we have a hydrocolloid. Now these are good for dressing or for wounds that have a light amount of exudate. Next we have the alganates, and the alganates, unlike the hydrocolloids, they are good for large amounts of exudate, so you have one on each side of the spectrum there. We also have what's called a silver impregnated alganate, and these are really cool. These actually are great for infected wounds, and they go in and actually have an antimicrobial aspect to them, so they're great for infections. We also have foam, and those are good to help keep in moisture, and they are good for adding some padding. So there's some different kinds of dressings, and then lastly, real quick, we'll talk about the drains. So after a surgical procedure, patients will sometimes be put out in post-op with different kinds of drains, and these would include the Jackson Pratt or the JP drain, Hemovac, and a what's the last one? Penrose drain. So the Hemovac and the Jackson Pratt are both neat in the aspect that they are they have like a pressure aspect to them. So basically they are rolled or pushed down or pushed flat, and this kind of allows a suction to draw the fluids out of the incision site. The Penrose is more kind of lays in the incision site and draws out that way, but they all are actually attached to the incision to help draw out any fluids. So that concludes this video.